Good afternoon. My name is Jennifer Parish. I'm the Director of Criminal Justice Advocacy at the Urban Justice Center Mental Health Project, and I'm a member of the Halt Solitary Campaign and the Jails Action Coalition. Thank you for the opportunity to testify. In my testimony today, I want to highlight three main points. First, the suffering in the city jails must end, but that will most effectively occur through decarceration, getting people off of Rikers Island, not by continuing to budget for more than 7,000 uniformed officers. The DOC is one of the most richly staffed jail systems in the country. We need to eliminate the more than 1,300 vacancies that exist. That would save us $174 million annually. This money could be much better spent on community resources, including mental health services and alternatives to incarceration, that will enable us to reduce the jail population and provide people the supports they need to thrive outside the jails. Second, the Department of Correction must invest in effective therapeutic programming to successfully implement Local Law 42 and end solitary confinement once and for all. With a mayor and commissioner who believe in ending solitary, they must follow the law which the council enacted in 2024. And that includes quality programming as alternatives to solitary confinement. We urge the council to support the department in bringing in outside experts with the experience designing and implementing effective programming, and they could do so for a tiny fraction of the funding that's allocated for the vacancies. Finally, the council should increase Board of Corrections' budget so that the agency can provide essential oversight and transparency needed. In at least the last 30 years, the board has not been funded at the level required to perform its vital function. Currently, the board's funded for 33 staff who have tremendous responsibility to monitor jail conditions, conduct investigations, compile data, and publish reports. The board staff in the facilities are essential for addressing abuses. And if I could just give one example of the importance of the Board of Correction, in December, their staff identified in the solitary confinement units at West Facility people who were being held in smocks without their clothes and required to wear diapers. It took the board's much advocacy with the department to get that corrected. So it's essential that they are fully staffed to be able to have people in the facility to observe conditions and correct them. Thank you.
Thank you.